I think it was quite amazing in this session this morning how there was this common understanding over the three sessions, in fact. So it's I want to comment on the three together because they're so intertwined, and I think it has been very, very useful, at least for me, but I think for the whole Cochrane Rehab management to hear this, yeah, almost cry for help, I would say, for increasing the education. So we started from the low middle income countries, where it was quite clear that there is a lack of basic training on interpreting evidence, able to then in the end to be able to use it. I must say that up to now we rather had this idea that there is already spread basic training on evidence-based medicine in general. There are some online services, but clearly they are not enough and not used. So we thought just to focus on rehab specific aspects, parting from the idea that people already have a basic training. But it's not because in some countries it's like that this is for everywhere. So I really think we have to rethink that. It's clear also that there is the aspect of then having the evidence on the one hand, but then applying it, making it available, accessible in different contexts around the world, in different types of areas. Also there we have to work on the types of products that we produce, because even access to internet is not always available. So I mean, I had some nice proposals I think we really have to do another session or another meeting on concrete ideas. Also, we will have then the input from the workshops, obviously, where we can further elaborate and then to really make an action plan. But it's clear that we have to also, as Stefano said, build the capacity and work on the pull of the people. Not only, I think we have been quite good in disseminating, in pushing it out, in spreading the news, but we clearly have now to focus also on having people being, creating capacity of people to use it. And then there is interpreting it, but then even putting it in practice is still another step. It's really implementation. It's the whole action cycle. I think what we also heard yesterday on the methodology, if we can improve also the replicability, the reporting, and the conducting of studies, they will also be more easy to then implement in practice. So I also want to link to the session of yesterday. And then there is the aspect of how getting it, as we heard at the end here, getting it in the financing system, in the health coverage system, in the insurance system, in the health policies. So also there is the aspect of evidence, but then also the cost benefit. And I didn't have time to look at all the questions, but I think also Saint-Florian wrote something on that. So it's a whole thing that's very important. And I think there the work that the rehab program of WHO under the lead of Professor Alarcos Cesa is doing is really quite amazing. And now in January will be launched, I think, the World Rehabilitation Forum, and the idea is to work for a resolution on rehabilitation. And I think also this advocacy is very important, to go to the health policies and the ministries to really invest in rehabilitation. And if we can provide the evidence to do the correct investments on things that work, I think then the whole puzzle may perhaps fit together one day. So that could be our new dream for the next 5 or 8 years, for the rehabilitation 2030. So we still have some time, we still have 8 years. But that, I think that could be perhaps a small summary of what we heard today and yesterday. So I want again, I said it already yesterday, but for the people who are here now, I want really to thank again everybody working with us, our headquarters, especially the last weeks, preparing all these events, our executive advisory committees, all the members of our advisory board, and the whole rehabilitation community worldwide who has been working so hard to realize what has been achieved. And I really hope we can continue to count on everybody and even more in the future. Thank you also WHO for the opportunities to work with you. And I also want to thank our sponsors, but without some funds for at least our headquarters, our researchers doing the reviews and working on sometimes very hard deadlines. I'm looking at Wouter now, to produce the rapid reviews that sometimes are really very, very rapid. So I thank the Gnocchi Foundation, the Galeazzi Institute, Montecatone Rehabilitation Institute, the University of San Vitello Napoli, ISPRM, ESPRM, the USPRM section and board, and the European Academy for the sponsoring we had, and we also hope to continue to count on sponsoring. The more people we can make work, the more we can do. So I hope we can continue on this surfing this wave also in the future.